Patients in Murang'a no longer carry a physical card. They just walk in with their ID. The data is fed into the computer. Then they can, if they so wish, they can print it, but it's also stored in a manner they can access it digitally later on. And therefore, that helps in terms of mobility of data. So that if you go, let's say you're a Murang'a patient, you go to Nairobi to seek further medical care, you will just enter into our health portal, retrieve your data even outside Murang'a. That also secures patients' data for eternity, because if you get medical card, it can get lost. You can store it and it is misplaced. The other issue is if you get an accident, for instance, you are brought unconscious before a doctor in Murang'a, you may not be able to explain to the doctor your prior condition because you can't speak. So there's every likelihood the doctor will do an intervention without him knowing your history. Maybe you are anemic or whatever. So you will practically die because the doctor will be doing guesswork. But now that the information is already there, if you have been coming previously to a Murang'a medical facility, so you get better treatment because the doctor has your prior data when you are being treated. The other issue is decision making. Previously, we used to do a little bit of guesswork in terms of, let's say, stock refills of our medicine. But now we know what area has certain prevalence, let's say, of malaria and so forth. So we'll be able to stock our data, our medicine, in a more logical and empirically grounded manner. And also monitor when our stockouts, when we're having stockouts using live data as opposed previously. Finally, the main success also has been in terms of revenue. The overall county revenue, when we came in, our own source revenue used to be about 400 million per annum. Now it is 1.3 billion as at last financial year that ended on June 30th. And the largest contributor of that was money in our hospital ecosystem. So that means now our hospitals has more money to be able to handle small issues. And we believe that has come out because of digitization, which has sealed loopholes. So what are the challenges? Challenge number one is internet. Our internet, okay, I don't want to speak ill of anyone, but we are really having a problem with stability of internet. We have engaged with the internet provider to see how that can be remedied. Maybe satellite internet is the way to go. I hope that market is expanded because that will definitely help our rural facilities that do not have fiber. Currently, we are using, I think they are called internet routers, which every time I see our medics reporting fluctuation of internet provision. Second is power. You'll sit in a medical facility, you hear the national grid is off 2 hours. And you know that has a life and death effect. You're a doctor, you're operating, then the power goes off. Of course, we put out generators in our main facilities, but what about the very rural where we can't afford generators? So we have come up with the idea of solarization of our medical facilities. We have about 170 or so medical facilities. As of now, we have solarized about 100. So we need to solarize the balance of 70. And even those that we have solarized is not per se full solarization. We might need to look for more money to ensure we have total solarization of our medical facilities. Thank you.
Thank you so much, Your Excellency. We'll move on to our county where tech is working quite well for them. Your Excellency, Deputy Governor Lucy Mulili, your county, Makueni, has embraced prompt solution. And from your perspective, what has been the most significant impact of prompts on maternal health outcomes and citizen engagement in the county? And you can also tell us what key factors contributed to its effectiveness.
Thank you very much. I must say that prompts has been a partner in Makueni, and there have been very many positive outcomes of the utilization of prompts in Makueni County. One of the outcomes is that we have over 20% increase in prenatal visit by mothers who are expectant, and that means if they are able to go at least 4 times before they deliver their babies, and that means better health outcomes. And this is because of the SMS system, which has been previously presented here. And we think also that's also a very good interaction between the mothers to be new mothers with the health system. Of course, the other, we have seen also an increase in the postpartum uptake of family planning 2 times than what was previously there. And that means there's very, very good communication during the prompts, so that the mothers also don't get surprises 3 months down the line and there's another baby inside the womb coming up. And I think it's good for decision making, but also having control of how many babies you want, even from an early age. And I believe we are seeing, of course, a very one of the good outcomes. I must say that as a county government, we have seen real impacts on the mothers, and the feedback that they get through the SMS has improved the maternal outcomes. We have also seen an increase in the 6 months breastfeeding of babies, exclusive breastfeeding for mothers, just being informed that breastfeed until your baby is 6 months, and that means they have healthier babies. Their success, the success factors, I must say, it's about the government of Makueni commitment to digitization, and we support digitization, and we also have some systems that we have put in place, but we realize the importance of digitization. And secondly, one of the success factors is that prompts has been accessible, is easily accessible, whether it's the small phone of Kabambe to the young mothers we have seen. They are able, because they don't need data. So that is one of the success factors that I must say has helped. And we are grateful that Makueni County is a success factor in this. We have a very strong partnership department, and we have many partners, I think over 60 partners that are working with us in Makueni County. And truly we appreciate. Of course, we in Makueni County, and I believe this is the prevailing figure across, probably across the country, we know there are some mothers who may be left out, especially when we talk about the teenage pregnancies, because in Makueni County we have about 17% of the mothers delivering in the facilities are teenage mothers, and they may not achieve the actual milestones as the others who may not be teenage mothers. But I must say that we are happy with the collaboration that we have with Jacaranda Health, and we are grateful that we are achieving milestones and we are seeing good successes. Thank you.
I'd like us to transition now to Ms. Cynthia Kahumbura, the Co-Executive Director of Jacaranda Health. as a leading partner in this space, how does Jacaranda Health align with these strategies at the national and county level? And what is your vision for the future?
So, one thing that is important as a part is we must work with national and county government. I think we've mentioned, our platform is AI enabled. Now, does that mean we started using AI a lot? Of course, even before other organizations were using it. But we're also working very closely with the different policymakers to ensure that we're aligned and that we're focusing on the national and county strategies. Because we are not in the business of creating innovations or solutions for ourselves. It's actually for Kenya. We are not here to say, oh, it's about prompts. It's actually about the mothers. When moms join prompts, they get a welcome message from the county, not from Jacaranda Health. So we must build and we must innovate and we must make sure that we're working with national and county governments, because that's the only way we will be successful. And as we're looking at integration into the digital superhighway, this is why we've invited panelists here, but also working closely with the different ministries to understand what we've built. How do we integrate? How do we make sure that that mom that is being recognized by a unique identifier will be recognized across the board, so that information is being shared and that they're being served by everyone, not by multiple people. And I think as you ask about the vision as we as Jacaranda is that every mom delivers safely and every newborn gets a safe start in life. And let me be clear about something. Everybody here was born. There could have been a complication, but they were born, they were delivered, and they were taken care of. Even if there were struggles within the first 5 years, they have been taken care of to be able to get here today and to sit here. So this is where we must focus and we must work on building this system. Even when a woman is having a complication, it is not just one person, there's a team. How is this system working together? We're digitizing, we're making sure in emergencies we have this. What are we also doing for prevention? And this is where prompts and other partners come in. Because then we also look at not just dealing with the emergency, but also dealing with prevention to reduce the number of complications that are also happening. So for us, I think, our vision is how do we make sure that every preventable death is being avoided. And we'll do that through working with national, county, different partners to ensure that moms and newborns are receiving quality care.
I wanted to bring in now someone who has actually benefited from prompts and is now an implementer. That's Miss Maureen Maria. You're the person everyone in this stage is speaking about, all the panelists are speaking about someone exactly like you. So as a mother who has personally used prompts during your own pregnancy, could you describe how the platform directly impacted your healthcare journey? What specific features or information you found most valuable, and how did it make you feel more supported or empowered?
Thank you for this opportunity. Thank you for this invitation. I'm so honored to be here, and thank you so much. So back 2021, yes, I was already working as a nurse and a midwife. So the Jacaranda team came to roll out the platform, the prompts platform, that I was now among the implementers. And then coincidentally, I was also expectant at that time. So I was like, why not also try this platform and have an interaction with it as much as I'm a healthcare worker, so that I also have an insight on it. So on the support on pregnancy, So this platform actually, because I've followed it from my entire pregnancy, postnatally, and even another pregnancy that I had, and even postnatally. So during pregnancy, I received several messages concerning pregnancy from danger signs, on hygiene, on nutrition. Like there are so varied messages on exercise, as well as you can also ask questions and get feedback, which was really, really important. I remember there's one time I used to have back issues. I posed a question. They gave me an answer that I even myself as a nurse, I didn't know that you can even use a pillow, put it on your legs when you're lying on the side, left lateral side. And it was so relieving. Sometimes I even use it when I'm not even expectant. It is so relaxing. So that was really good. And then something else, receiving feedbacks, that was really, really helping, because if mothers can ask someone, if they can find a platform where they're asking questions, receiving feedback, that is really helpful. And also it gives the mother like a voice, somewhere they can even send feedbacks concerning their healthcare, the quality of services they received at the facilities. And also it empowers these mothers on on various uh, on various key areas concerning their pregnancy and even postpartally. Something else on the valuable features, the two-way SMS system, because you can send messages, you can receive feedback. And another valuable feature was reminder on the ANC visits. By the way, I used to even forget. Yes, I'm a nurse in this profession, yes, but I could even forget on the visitation. So it flags you on the visitation. It flags even if you have a danger sign. Though I didn't have a danger sign, but I've interacted with mothers who've come with danger signs. So those were really key features on it.
Thank you so much, Maureen, for that insight. I'd like to take this back to Engineer Kipchumba. So we'd just like to know, how does the Ministry of ICT and the Digital Economy collaborate with the Ministry of Health and with the county governments to ensure that digital health solutions are not only technologically robust, but also integrated seamlessly into existing health systems for maximum impact?
Thank you very much. First, I would want to start a response to His Excellency the Governor about connectivity. The concern you have in Muranga is actually the concern in many parts of the country, because now we find the demand for broadband is increasing, reliable and effective connectivity. The private sector has also made quite some effort. By end of 2022, we had only 1.2 fixed broadband connections on fiber, the whole country. That includes homes and businesses. As of now, we are around 1.8, approaching 2 million. We have Kenya Power already connecting towards 9.5 or almost 10 million homes connected with power. So there is quite a lot of work we need to do when it comes to fiber connectivity. And for that reason, we changed the model of connecting so that we can leverage the over 300,000 kilometers of national power grid, so that we can achieve that connectivity. So we've identified 74,000 public institutions across the country that needs to have broadband connectivity, and it will also support the private sector, including Safaricom and all the other that provide also services to the citizens and businesses. Going straight to the point you have said, what we do as a ministry? First, we are responsible for improving the policy environment. We have the ICT policy, which has been guiding our journey as a country, ICT policy of 2019. We also developed a digital master plan 2022. And this digital master plan is the foundation of even the digital, the bottom-up transformation agenda. That really defines the digitization. We've also developed the digitization guidelines that will help both ministries, agencies, and even counties on the digitization agenda. We developed Data Protection Act. There's Computer Misuse and Cybercrimes Act. We also have recently issued or developed the AI strategy and the cloud policy. All this is to enable the ecosystem within the country to adopt emerging technologies and to benefit both the national and county government. We're trying to structure so that also we remove silos. This is something we are trying to do in government, because so that not every institution builds its own data center, so that what can be shared can be shared. And we think that solution we have at the Ministry of Health is one of the best solutions that we have brought out as Ministry of ICT, Information and Communication, in that we developed jointly the design. Working with the business owners in the Ministry of Health, we came up with this system so that we are very clear about what is required and can meet the needs of government and address the challenges that has been there, and open possibilities for Jacaranda and other partners to integrate so that we have one system. So that even private sector NGOs should engage now Ministry of Health and see how we can leverage on this one patient, so that all the solution we deliver is citizen focused and patient focused. Thank you.
Ms. Kahumbura, I'll bring it back to you now that you're talking about partners. From your perspective as a partner, Jacaranda Health has significantly expanded its reach across countries. Represented here, we have Makueni, Muranga. How does Jacaranda Health's solutions ensure that the solutions remain adaptable to diverse county contexts?
For us, what we've done is we've tried to make sure that we're available to anybody who has a phone. And if not, also through CHP or as like a central point to be able to reach moms who may not have access to a phone, like teenage moms, as was mentioned by the Deputy Governor. I think one of the things as a partner is we're always asked to come and do everything. We can't do everything. So we always ask for coordination and support on if there is another partner working in this specific area, how can we partner with them? How can we leverage the existing resources that are there? And instead of, just as engineer said, let's avoid duplication and let's leverage the resources we have. We're reaching the same woman who is being reached by 10 other partners. How do we make sure that we're reaching this woman efficiently and effectively? And this is where, a lot of coordination needs to come in as well, and resource mobilization. Because also as we're looking at resource mobilization, as was mentioned by Dr. Luga, we don't have the money we used to, and that is a fact. We are donor funded. So how is it that we're going to make sure that we are spending that 1 shilling as best we can, and then also partnering with partners such as the ministries, the county, on how do we make sure that that 1 shilling is being maximized and used to the most of it. And for us, then we can invest in the adaptation and the personalization of our products, as we're having counties like what Rose said, they'll own prompts, even if we have other innovations. So how do we make sure that we're actually handing it over? So we go and do other innovations. So we go and continue building and researching.
Your solution makes it possible for inclusion of women's voice, right? In health system improvements. How does Jacaranda Health Solutions specifically empower mothers and communities to provide feedback and influence the quality of maternal health service?
So I think as Rose mentioned, we ask moms about when you went for your antenatal, your postnatal, and also during your delivery. were you treated with respect? And we actually define respect based on WHO standards. And then we don't just stop there, like yes, no. If it is a no, we actually continue to ask, what happened? And when a mom says, you'll find a mom has good feedback. You'll find a mom was abused, we'll actually get cases of a mom was slapped. Someone was screaming at her. And what we do is we make sure that that feedback verbatim is provided to the facility and anonymized. So they will not know it's Cynthia, but they will know that this happened here. And what this does is it actually empowers the decision makers to then take action. Because you'll find, and this happens in a lot of facilities, when they find out this feedback is negative, they then go into doing respectful maternity care modules. They actually launch investigations to find out what is happening here, because they actually care. Whereas right now, if you ask a mom in the facility, did you write a note and put it in the suggestion box? The fact is she didn't. So we're providing this avenue for a mom's voice and for her voice to be heard and to be included in decision making for when she's seeking care. And this is what provides a higher standard of quality of care.
I think that just directly leads us to Ms. Maria. She's talked about her perspective as someone who's used prompts and given her experience now as a mom, and we want to hear from her now in her role, as enrolling and assisting other mothers. What are the most significant changes you have observed in their health-seeking behaviors and interactions with the facilities since they joined the platforms?
Yeah, so I've seen a change on mothers coming in early enough for their antenatal visits. They don't miss the antenatal visits. So mothers are really coming in for every antenatal visit because they have a reminder already. Something else on the danger signs. By the way, I really love this prompt so much because if we can really enroll all mothers, and even during preconception, I'm looking at it as a way of addressing the first delay on the 3 delay model of maternal mortality and even morbidity. Because if a mother comes, once she notices a danger sign, then we can reduce morbidities and even now mortalities. So something else, I think those are the major I've seen. Yeah.
All right. We'll now move on to Governor Irungu Kang'ata. As we look to scale these successes that we're hearing here today, and given that health service delivery is a devolved function under the 4th schedule of the Constitution, what specific support do counties require from the national government and development partners to ensure there's effective adoption, implementation, and sustaining innovative digital health solutions that accelerate achievement of the UHC?
One is in good policies. I say so because there was a time a provider of internet, satellite-based, came into this country, and there was some disruptions in the market. Then I saw a proposal to bar that provider, and I'm not so sure whether the ministry acted on that, but if they acted, it is wrong. Should allow competition. And for me, that satellite-based internet provision, I think, is the way to go. I say so because I suspect fiber-based internet is redundant. As more and more entities go satellite, to be cheaper to provide internet through through satellite, and that will definitely open up rural internet connectivity. And for us as Moranga, we would really want the national government to support satellite provision of internet, particularly for our rural facilities. Secondly, is the issue of integration of these systems. The national government has brought SHA, and SHA has a portal. Now, Moranga has afya.ke. We would want those two connected. Otherwise, if you tell us now to migrate all our data to SHA portal, that will take time. So, I think we were given a promise that will happen. I hope it happens sooner. And not only SHA, we have another system for HIV. I think it used to be for USAID. Yeah, I think we also have another one for radiology or something. So all those several systems ought to be integrated so that we have you can move data from this system to the other one. The other possible area by donors would definitely be in provision of hardware. It's expensive to buy all those tablets we have, and they keep on having problems. So Muranga has to try and curb that. We have done two things. Number one, we have introduced a workshop at a hospital called Muriranjas for all our computers in the health sector. So when those tablets get problems, we now take them to Muriranjas so that somebody is there to try to make them. Secondly, now we go on the practical side of digitization, which is making work easier for patients and medics. Muranga has introduced telemedicine, which is riding on the platforms of this digital space. So patients in Muranga who have chronic ailments like cancer, high blood pressure, diabetes, and so forth, they used to travel all the way from the forest. Muranga nears Abadeas forest or Ukambani region. So they would go to Muranga level 5 where the experts are domiciled. From the forest to Muranga, that would be about 1,000 shillings and from. So, and again, the line will be too large. So we reasoned, now that we have internet in almost all our facilities, why can't we now do telemedicine? So we appointed one facility per ward, where those patients, we registered them. There are about 20,000 who came into the platform. Instead of them coming to Muranga level 5, they go to the nearest dispensary. We put out a computer there. Now they go and talk to a doctor who is, let's say, in Muranga level 5, and they get consultation via online. Then they are assisted by the nurse who is in that rural facility, and then we place their medicine in those rural facility. That then means you cut their distance to Muranga level 5. You also give them appointments that are scheduled. Instead of them just walking in, they know on this and this date, I will go to my telemedicine center, and therefore we shall be waiting for them. And because these diseases are fairly known, so the management becomes more objective, and that then prolongs those patients' lives, and you increase life expectancy. We believe that has been one of our most important effect of digitization, because now that has made medical practice more fairer and more objective, and it reaches people near where they live. Thank you.
Engineer Kipchumba, from your perspective, what are the most significant opportunities and challenges in leveraging emerging technologies, especially such as AI, to strengthen Kenya's health sector and accelerate the achievement of universal health coverage?
Emerging technologies, including AI, will really improve the quality of service in the healthcare sector. One, it will fast track diagnosis. You've had one of the biggest issues, even the PS talked about, is wrong diagnostic or slow diagnostic. Adopting these emerging technologies and AI, you can accelerate that process. The second one is also empower the service providers. AI, just like any other tool, has huge value. First, it empowers you. You don't need to remember the basics. The AI tool can actually help you to you don't make obvious mistakes. So giving this platform across the healthcare service providers, it will improve the quality of service across government. We already have the AI policy in place so that we can be able to deploy. We want to see more use cases for AI, including healthcare. And this is opportunities also for our software developers, those who are in AI, to see how we can have more use cases for AI. This week on Monday, we launched one program with Meta using Llama models, and we were very excited to see the interest from Kenyans and the quality of proposals and solutions. And we have a team joining the Llama Accelerator program, and it's mainly on use of AI. Also responding to my friend Governor, Your Excellency, the aspect of Starlink, it is actually our government who went ahead to invite Starlink. We went to the headquarters of Starlink. His Excellency the President himself went there, and they were invited. Government was among the first one to pilot. We deployed in a number of the vet institutions, and currently we're working with Ministry of Health, Digital Health Authority. Probably the first 100 will be deployed in another few weeks to these remote hospitals in the country, so that they can benefit also with inclusion to ensure no part of the country is left. We are also working under the World Bank project, Kenya Digital Economy Acceleration Program, to acquire additional so that those far-reach areas can benefit using Starlink. But fiber connectivity scientifically is still a better in terms of capacity. What we need to improve is reliability. And we are doing everything in the country to make sure our fiber connectivity is reliable. We already have 8 submarine cables connecting Kenya to the rest of the world. A few weeks ago, we connected Kenya to Tanzania at the coast, Oro and Lunga, to ensure the 4 cables in Dar es Salaam and the 8 cables in Mombasa are interconnected. We are working at connecting also across our border so that we improve reliability. So another 1 year to 2 years, we want to make sure the fiber reliability moves to the next level, so that this infrastructure, it will become now really a basic service to have broadband connectivity. If you have telemedicine service and connectivity goes down, it's a critical issue. And you talk also about power. I think jointly with Kenya Power, this is also another issue we need to work on, so that healthcare would not suffer because of power and connectivity. Thank you.
I'd like to come to you now, Your Excellency Lucy Mulili. Based on what the PS has shared, and given your strong advocacy for social inclusion, how has Makueni County leveraged digital platforms to strengthen citizen participation? And what strategies has Makueni County put in place to ensure that digital health solutions are accessible, inclusive, and beneficial to all, especially for populations in remote areas and those with limited digital literacy?
Thank you. Listening to just what the PS has said, I think he has talked about, I've heard you say about the 100, which you'll be launching soon on, I think, Starlink to some of the facilities. we appreciate that you're really helping the counties really to achieve faster internet connectivity, and we truly appreciate. Let me just say, just to answer your question, that just out of we learn a lot from Muranga. Governor Muranga, Your Excellency, we learn a lot from you as a Makueni County, and we continue to get lessons from you because you're really trailblazing. And very soon we shall be launching Makueni Mutulake, just having been able to learn from you. So I think about the question, I would say Makueni County, we have a number of ICT solutions that we've been able to adopt just to help in the management and delivery of the health services. We have the county health management system, and we are, which was rolled out in 2024. It's operating in a number of facilities, including our level 5 and some sub-county hospitals, and they are connected, and we are able to tell how many commodities have been taken where, how many patients we've been able to see, and we no longer use cash money. We're using or M-Pesa transactions, and that has helped. Again, just as Moranga, we've been able to again raise more revenue from the provision of the health services. I am also, we also, as a Makueni County, we also have, because of inclusion, what you've talked about, we have 17, which we call CICs, county information centers, whereby the youth are able to go there, they're able to be trained free of charge. And they are in 17 different areas within different wards within Makueni County. And we encourage youths to go there where they get free training. And that is part of inclusion, which Makueni County has been able to do. We have Makueni County app, where there's an opportunity to talk to the governor. You're able to sema na governor Makueni County app, and we're able to receive feedback also from the public. So even as we go forward, we as Makueni County, from the data that is being collected by our partner, that is a Jacaranda Health, which we are here today, is helping us be able to get data and make decisions on what we are getting from the outcomes, from what we are getting from Jacaranda Health, from the many mothers who are in that platform. And this is demystifying pregnancy. It's important to demystify pregnancy, not only to the mothers, but also to the fathers. And I believe even fathers can send a message through that SMS and ask, why is my wife eating some soil? Why does she think that kitungu is smelling very badly? You know, it's important to demystify those kind of things, and therefore it's a whole family's journey as they wait for the newborn baby. I thank you.
We have time just for 3 questions. Please keep them short and clear, and let us know if they're directed to any particular panelist. So we can take some 3 questions for the panel. I see a hand there. There's a mic that will be brought to you. And I think 2 and 3. Yes, so we have our 3 questions. Please stand up and just make it short and very brief. Let us know if it's directed to any particular panelist. Thank you.
I am Mariana Mulmurray. I work for the United Disabled Persons of Kenya. I am an assistive technology user, and I have experienced firsthand the benefits of technology. Questions as both to the governor, Jacaranda Health, and the PS of ICT. The prompts platform seems to be a real deal, but it would be good to know how accessible it is to persons with diverse disabilities. The PS has also mentioned universal access and the Center of Excellence. According to a research by Kiktanet, most government websites are inaccessible. The governor also talked about the launch of telemedicine. What deliberate efforts are put in place to ensure accessibility to everyone, including persons with disabilities, and not just collectively as the most marginalized or the underserved, but deliberately categorizing the needs of each category and addressing their unique needs to ensure they are not left behind?
Hi, everyone.
Hi.
My name is Ben Rose. I also work with UDPK as a disability inclusion advocate, but I think Marianne has also asked my question. Mine was specifically to know how inclusive the digital well-being will be to persons with disability, especially how Governor Irungu Kangata mentioned about telemedicine.
Okay, so hi, my name is Chadwin Uhuru. I work for Smart Applications. So first, I would love to recommend what Governor Kangata has done to Muranga. It's an impressive job. Now, maybe a quick question to him, the governor. You've talked of patients accessing services using IDs. So is using ID an effective way to maybe curb things like fraud? Because we know in Kenya now, people are impersonating everyone anytime with anything. So how have you, or what measures have you put in place to ensure that the one who is accessing the service at the hospital is the exact person, but not someone else who is coming to maybe access service on behalf of someone else? Another question, just a quick one, is the system that you already have, does it have an intelligence maybe to show you how you can expand to various places? And probably Maragua requires more attention than Gatanga. So what are the measures you've put in place to ensure that you've expanded the services to the whole county?
Mine is a question come proposal, and I'm looking at the counties, Your Excellency Irungu Kangata, and my former boss, Excellency Lucy Mwilili of Makueni, DG. I'm a storyteller myself. I do storytelling. And currently I head the Kenya Yearbook where we do storytelling. And how can national government partner with county governments to share information to the last mile, to the grassroots? And I think also Jacaranda, we have the platforms, MyGov and other platforms, and a lot of, it's just like the things that we're sharing today in this room. The people who are not here don't have the context. How can this context get out there so that we have everybody getting this information and they can get supported? So Excellency Kangata, Makueni DG, how can national government through Kenya Yearbook Editorial Board, that is a content and communication agency, partner with your counties to share this information at the grassroots?
Thank you so much. We'll take the last question now.
Thank you very much. Ngori, working with the county government of Nyeri. I want to light on my sister's question, the issue of accessibility to information or for persons with ability. Mine is very specific. Sometimes persons get information very late. Like even where we are today, the sign language interpreters have come late and persons with ability miss some information. What are we doing to ensure that they receive early? Number two, information security. However much we are told that the information is secure, and through the internet system, your information can be accessed in any part of the world. How today are we ensuring that the information is sure and nobody can truly share it and or pick your ID number and access your data unknowingly? Then that question is very brief. Customer care, where has it faded to, because it's not there in our facilities? Then finally, is depending on Google reliable, or would it lead to misdiagnosis? And especially sometimes somebody is quickly diagnosed And the intervention that is done, sometimes the long effect is not taken care of. So an intervention is done, it affects some other issues in your life. Then finally, what strategies does Jacaranda have to reach the unreached counties? Thank you.
Thank you so much, Kingori, for that question. I think the audience has asked their questions directly in order of how our panelists are seated, and each person will have something to address. I'll start with Governor Irungu Kang'ata.
Okay, allow me, because I have seen the people with whom we work are here. So they help me answer this question. So Dr. Wendy, please be upstanding. She is the one who heads the telemedicine site in Moriranja. I think the question was about people with disabilities. How do they access, let's say, telemedicine?
Good afternoon. I'm George Gongo. I'm a clinician. I work under Wendy.
Good afternoon. I'm Elizabeth Njaramba, a clinic officer working under Wendy.
Good afternoon. I'm Elizabeth Jogo, a clinical officer working under Wendy.
Good evening, everyone. I'm Irene Mushero, a clinical officer coordinating telemedicine services in one of the health centers that has the highest number of patients seeking the services. Thank you.
Good evening. My name is Alex Maina. I'm a clinical officer working in one of the facilities that has telemedicine.
So to answer the question on how we handle some of our patients who have disabilities, so for our patients who come in and maybe they are mute and deaf, and they might not, of course, be able to communicate with the clinician on the other side seated that they have, we normally have someone assisting from the facility. And so we give them time to just write down, and then we can have someone read out now to the doctor. And when the patient requires to ask something, they just write down, and that is how we communicate with them. So for them, of course, we give them more time so that they can be able to express themselves. For the ones that are maybe blind, the person who is assisting from the facility is the one who will maybe read out the drugs that the patient is using. Thank you very much. I hope I've answered the question.
Thank you so much. Some of our staff are still in our booth, so I'm the only one from IT department. So on the question, we use ID because it's a unique identifier, but when we do customer or rather patient registration, we take their biometric details. So we have their fingerprint and also their photo. So when you attend to them, you can also verify that using their images.
The question on upscaling as to whether you can move from Maragua and to what extent is upscale to other facilities?
I want to assume you mean drug distribution. For example, from the system you can see the number of paracetamols in Maragua. If Kandara is in need, you can then reallocate from within the system, if I understood your question.
Okay, I think basically what Meshak is saying, almost all facilities are digitized. So therefore, and they talk to each other. So whatever is in Maragua is in Murang'a, is in Kirwara. So everywhere that system is there. Thank you, Meshak. I think I'm done.
Okay, thank you very much. I'll also take a similar route of Governor Murang'a, as I've said earlier. But let me also take the challenge from the CEO Kenya Yearbook. I must say there are so many stories, and from here we will get in touch with you, because there are so many successes that are happening at the counties, and we really need to tell our story. When we do not tell our story, the successes that we've been able to achieve, we lose a lot. And it's important to share what is happening. And one of the things that I've noticed with Governor Murang'a, when you're on Citizen, we are there. I'm there watching you. Yeah, many times you go to Citizen and to radio. We have learned a lot. So we have very many success stories in Makueni County. And last year we introduced, I'll give Dr. Mosila to say, Dr. Mosila, Dr. Mother, and the ICT here, champion CECM Elizabeth. Let me say this one story. There's a drug we started using recently, I think a year ago, if I'm not wrong, it's called heat stable carbetocin. I don't know the other name. But the people in the wards who do the cleaning, they say the floors are now dry. And our mothers are no longer at danger of dying because of, postpartum bleeding. And that means we are even saving more lives. And again, 2 years ago, we did a wonderful outreach to mothers on, I don't know what we call it, the fistula. And I was so shocked because of our society. Not just Makueni, but the way our society is. We did 80 surgeries in Makueni for mothers with fistula. But I felt my heart broken when I went to the hospital and I was able to see a 70-year-old mother, 80-year-old mother, and I wondered, where have they been all those years? Suffering in silence, staying out of people, staying away from their community, from their family. So there are many stories which we can talk about on the achievements that have been made in the counties, and I thank you. Let me give Dr. Musila just a minute to say something, and Elizabeth and Dr. Mwatha. Thank you.
Thank you, Your Excellency, and all protocols observed. My name is Dr. Paul Musila Waziri. So, yes, we have worked in this space of ICT since the time we got into office. Because for me, it was for me to shout about the pain points from a medical perspective. And our Waziri, Elizabeth, would now sit with me and actually just listen to me. Occasionally, it would require us to have our interns and the rest of the team just in one room. Me and my team, Director Mother and the other people talking. And the ICT team just doing their things on their gadgets. And from that, actually, we got homegrown solutions that we've been able to utilize, especially for the commodity management and also for the, county integrated healthcare management information system, which we have deployed in the county referral hospital and in our level 4 hospitals. We are happy, and that the national government actually now has come in strongly, and we sat in the platforms that with the DHA, with the SHA, and basically discussing the kind of platform that we would like to see deployed to bring us all together. Because really, as a country, we cannot have 47 counties, each doing their own, little things. And even within the 47 counties, as His Excellency Governor Muranga said, you still find we have different systems within the Department of Health. Some run purely by partners. Ourselves, we actually don't even have access to that data. And health data is very sensitive. So there are a lot of issues that we need to comply with in that space of health data. So really excited. We have engaged with the DHA, we have engaged with SHA to ensure that actually we can achieve that kind of digital superhighway that we have always been talking about. And everybody and anybody who has a system should be able to basically enter the highway. If you cannot enter the highway, unfortunately, you'll be locked out. Thank you, Your Excellency. Madam.
Thank you very much, Your Excellencies, and all protocols observed. My name is Elizabeth Muli from the County Government of Makueni. Just picking up from where my colleague has said and following up the explanation from His Excellency, Dr. Kangata, as a county government in Makueni County, we have been able to use technology basically to enhance service delivery in the healthcare system. With the first innovation at the county, homegrown, as Waziri has said, ensuring that we focus on the patient care. We want our patients, when they come to the hospital, to be able to be tracked throughout their journey, so that from a place of service delivery, we can ensure that whatever services they are getting, we can push the enough workforce and resources to ensure we deliver the same. I know all the counties basically suffer from commodities management. And again, from what His Excellency has said, the county government of Makueni has, through the implementation of the system, we can be able to even do inter-facility sharing through the system, because we can see the stocks that are available, and hence we avoid wastage and a lot of expiries. And finally, revenue collection. One of the key things I would say, and has been the biggest achievement as a county, is the revenue collected through the health systems, because we were able to move from revenue collection of about 300 million in 2022-2023 to now closing to 700 million in the just concluded financial year. So that means that we are able to ensure that every single coin collected through health, and the PS was very clear to say that health needs financing. So I believe that through the use of technology, we are going to achieve accountability and transparency, that we can be able to offer services. But just before I conclude, I would want to just throw a question to our PS for ICT. I know DHA CEO spoke about the work that is happening in automation, the digital automation of health. One of our biggest challenges in the health sector is human resource. So my question is, PS, how are we going to utilize artificial intelligence and big data so that we can try and close the gaps on matters? Because with artificial intelligence, we can do some of the works that we don't really need human, interference. So do we have such kind of thoughts towards, as we continue the development of the system, the county-wide system? Others, thank you very much, Chief.
Yes, good afternoon, everyone. My name is Dr. Mwatha, Director of Preventive and Promotive in Makueni County. Just to answer a question that was asked to Her Excellency regarding how we share our stories. As a department, and I think this one we borrowed from the Department of ICT, we were assigned a communication persons within the Department of Health. And I'm glad the communication person in charge of the Department of Health Services is here with us. So we actually have the first series of Makueni, Afya Makueni, which is a series of sharing stories of what has been happening within the county. And we are happy that we launched it early last month. And that was the beginning of how we share stories of what is happening, because whatever is not documented is not done. Thank you.
I think this engagement is very good to get feedback and to see what's happening across the country in Muranga, Makueni, and also from the citizens. Inclusion, especially for people with disabilities, I think it is something important. Comment about some websites even not being accessible. And one of the things which has come also is the journey towards a unified system, so that we move from siloed system to a unified system, so that once you fix a problem, it's fixed for the whole country, including our government website. So we are working on that so that we make it possible for people with various kinds of disabilities to still access services, access information, and be able to utilize the system that are in government. The tools and technologies for access are there. It's no longer about whether the tools and technologies are there or not. The tools are there. They have been demonstrated in many systems. The remaining issue is how do we make sure it's deployed and it's made as mandatory for any new system that is being developed, that it has inclusion fully for people with disabilities. So we'll be looking at that to see how we can make it universal, that across government, the standardization is actually realized. There is also issue of identification. I think there was mentioned here, we've talked over digital identity as a country. We've started that journey, and this will help us so that we have what we've been calling a single point of truth, so that if you want to identify a person, you identify from one point and it's digitally identified. So we are working with the State Department of Immigration and Citizen Services to fast track the deployment and establishment of digital identity. This will now be a platform that is shared nationally, and it will help our people. There was also a question about information security, that as we move to digital space and digitize our services, how do we ensure that information security personal data is kept, personal data is protected, and privacy is realized. I think we already have the laws. We have the Office of the Data Protection Commissioner. I think they are at a stand here, and there is clarity on the roles of any data handler. And we want to ensure that every handler complies. If every handler complies with what is required, I think we have OTPC here representative to ensure that people comply. Once you comply, we will eliminate that likelihood. We are also joining global bodies that are responsible for data protection and participating both at the continental and global level so that we quickly update ourselves and align with global aspect, because cybersecurity data protection is not local, it's global. Also, there was also the question on which my sister asked there in terms of AI, how do we make it accessible to everybody? Actually, AI tool is almost going to be like grid, a national grid. It's like power. Everyone needs to be connected to an AI tool, an AI capability, or AI agents. We've laid the foundation with the AI strategy. We are working at the moment on the AI policy, and also working with the technology players, because it's an area that is change and progress is happening at a very fast speed. So we want to make sure we don't work in isolation, and our focus now is user case. So we want to make sure as we work with Ministry of Health, it is powered by AI, because it is about the impact that it gives us.
So I work in a sub-county hospital called Jacaranda Sub-County Hospital. And then back in some days, I also worked in our referral system in Kisii County. So in our sub-county hospital, once patients come in, the first person they are going to encounter most of the time is the soldier. So this soldier will identify a person with physical disability. He will be the first person to ensure there's a wheelchair. So there are always supportive measures if it's a wheelchair, if it's someone we need to support to be seen at the triage area, because that is the first place they will land after doing their registration. That can be aided by a treatment supporter or a family member. So they can just, the family member can continue the registration process, and then the patient is brought direct to the triage desk where the nurses are. And then we are the ones who will ensure they are even seen with priority at the clinician desk. I also remember when I used to work at our referral hospital, we have nurses who've done specialization in special needs and even sign interpretation. So for persons with disability on hearing, they can get interpretation with these colleagues. And even in the facility that I work in, we have colleagues who also help in interpretation. They can interpret to us, for those who don't understand, and even to the clinicians and the entire healthcare team.
Well, as we mentioned, we've been SMS based, but we've also started including voice, so that a mom can ask you can ask a question, and then you can actually get a call back. So we're really trying to see how do we not integrate persons with disabilities, and also to understand what are other channels that we can use to ensure that we're reaching persons with disabilities. And I think we've asked about scale and getting our story out there. And the question was, what's our strategy to get to niche counties and national? I don't like to be negative, but I'm going to start on a negative note. We have gone county by county to get to the 24 counties. We cannot do that anymore. There's no money to do that anymore, to get to 47 counties. And let me be honest, we're struggling to fundraise for us to get to the 47 counties. So I want to ask our panelists at government, how can we, not necessarily just cost share, but how can we go together to get reduced zero rating, for example, for SMSs. We're spending 70 million shillings a year on SMSs for months. When we go to Safaricom, I'm just Miss Cynthia Kaumbura, Jacaranda Health. But if I go with everybody here on this panel, we can get the zero rating. So how are we forming partnerships and leveraging our, whether it's convening power, whether it's influence, to ensure that we're remaining sustainable? Because we need that to be able to reach every single person, because we don't have those resources. But we are available. Anyone today, anywhere in Kenya, any woman can message 21884, get registered, and start receiving the SMSs. So how is it that now we create that awareness, we ensure that people know how to gain access? So really that's from a scalability perspective. And I just want to share, I think everyone has talked about technology. Technology is only as good as the people who use it. I just want to share that, because we can have all the AI fancy technology, but if it is not made for us, AI, for example, and we are not using it right, then it doesn't matter.
Before we conclude, they can just share each closing remark, just 1 minute. Please keep it very, very brief as we close, so that we can leave the audience with something that, the final takeaway from this whole conversation. What are your last remarks? I'd like us to go backwards the way we came through. So we'll start with Ms. Maureen, and then Ms. Kahumbura, then we go to PSICT and Makueni, and then we can.
Thank you. Thank you so much again. So my takeoff, I want to reiterate something that Ms. Kaumbura said on feedback and the ECCM Nakuru County Health. Now, the feedbacks that we get, we usually get the feedbacks concerning the departments of ANC and the postnatal department. So once these feedbacks get to us, many times it's the nurse manager who shares it to our WhatsApp platform, our WhatsApp group, so that we see our performance. And on the few negative feedbacks that we get, for sure, every time we have a meeting or we discuss about it, and so that we can improve the quality of service to avoid sending patients away. So on my takeoff, I was looking at, just a few days ago, I was looking at an article, two media houses articles that were, was talking about maternal mortality being 355 deaths per 100,000. That is really a significant number. And every time as a mother, I think about it, and even as a midwife, it really, really worries me. I've seen countries who have 1 to 2 deaths. The best performing countries have about 1 to 2 deaths per 100,000 live births. So countries like Belarus, Norway, Finland. So I think I really have a conviction that we can also get there. We cannot continue losing mothers. And for this platform of prompts that is really addressing the first delay, it is really significant. I don't know, it is really significant, and it has a great implication in preventing and addressing the first delay of the 3 delays, the 3 delay model of maternal mortality and even the morbidities. So, and then lastly, among the few things that I like the Jacaranda team to incorporate and even widen their scope on the preconception package, if that really can really help on the morbidities. Yeah, the preconception package, because we've seen mothers coming at late trimesters, and even the previous pregnancies, they had issues that were supposed to be addressed preconceptionally, like mothers who have a preeclampsia and eclampsia. For them to get to another pregnancy, there must be a package for them to prevent another hypertension disorder that can lead to morbidities and mortalities. And then something else, if I don't know if there is an integration package of these prompts with the Taifa Care. I think that one will really also will be very impactful. And then lastly, very lastly, yeah, and even at the extension of the messages, that we get messages up to 1 year. So if they can even be extended, because milestones are being monitored even up to 5 years of age. So with those many remarks, thank you so much for listening to me. I'm so honored. Thank you.
Maureen, we have extended to 5 years. Yes. I think the takeaway I want to leave with everyone is, and just going back, 80% of maternal and neonatal deaths are preventable. These are lives. So as we talk about everything here, let's be very clear what we're talking about. A life. And we must build and structure and make all our plans around saving these lives that should not have been lost. Thank you.
For our country, universal healthcare has been a vision, a dream for decades. We are at the point that we are seeing it becoming a reality. And we are very happy that the design that brought in the existing system today of Digital Health Authority, or the platform that is driving the universal healthcare, really looked at all the other aspects and integration to other solutions that can be provided by partners. It has addressed the issue of ensuring the power of the citizen. The citizen can own their data. They are the one to authorize their data to be used by any third party. We've also ensured that the citizen can move anywhere with their data. That is the design concept of the digital health solution. We've also inbuilt capabilities of AI into the system. So at this stage of implementation, we are very happy to see 25 million Kenyans already registered on the system. It's a huge milestone for our country. Over 5 million people having enjoyed this service with personal experience. So the journey has just begun, and I think we just need to support. We need to make this system work. It gives us data that was not existing before. You are able to see who served who, what are the issues in the country at an instant. You can give at a weekly, at a monthly. The power it is giving into the hands of decision and policy makers is unimaginable. So the possibilities of transformation in the healthcare and realization of universal healthcare is real.
When people come to this kind of conference, there's a lot of jostling of people saying, county officials saying, put me in the list. But now, we're automated. Now we say it's a very simple thing. We look at the system, we see who is the most productive county employee. Take, for instance, we said in the telemedicine, which facility had seen the most patients. I think it was Kireini. Can you be upstanding the person from Kireini? So we put her name there. Then we had Sabasaba in terms of revenue. So we put her name there. We had another one for which clinician had seen so many patients. Same way. So the list was generated by the system. Of course, there was some patronage, I know here. Those who are close to those who make decisions. But I think we are headed to the right direction, to the extent that opportunities that will now arise going forward will now be using the system to see who is the most productive employee, and therefore assign benefits based on productivity, not on patronage, how you know the boss. We are not there yet, but I think we are somewhere because of automation. Thank you.
Thank you so much. I'd like to thank our panelists. And today, I think what we've learned and what we've had is that technology is a powerful enabler, but only when combined with policy, infrastructure, and trust, of course. From counties like Murang'a and Makueni to national strategies, from ICT infrastructure to community health innovations, the path to universal health coverage will require all of us. Thank you so much. That has been our panel. We'd really like to appreciate you for your time and for being here with us. Remember, the main plenary tomorrow starts at 8 a.m. in the main tent. And yes, this has been a collaboration with the Council of Governors and Jacaranda Health. Thank you for joining us for this side event at the Devolution Conference 2025. I'd like to remind you to please pass by the Jacaranda Health Exhibition stand. It's number 279. If you have any further queries, any more information you'd like to know about the programs they run, please pass by and say hi to them there. Asanteni sana for your time. Goodbye and have a good evening.